Hello, I'm Dr. Gerald Harris, and I'm going to be talking to you today a little bit about platelet-rich plasma procedures for vaginal and penile rejuvenation and non-surgical breast enhancement. The platelets are the part of the blood that's primarily responsible for tissue healing and regeneration. The platelets are basically little bags of growth factors that float around in the bloodstream, and when the blood flows to an injured area, the inflammatory chemicals released by the injury site activate the platelets and they begin to release their growth factors. These growth factors are what trigger the healing process. The platelets are fairly diluted in the blood though. They comprise less than 1% of the blood volume. So just injecting whole blood into an area doesn't work very well. It just doesn't have enough platelets in it to do the job. Instead, we take the blood from the patient and put it into a special machine which separates the platelets from the rest of the blood components and then concentrates them. We then use this platelet concentrate by itself, or in some cases combined with a concentrate of the plasma proteins for an enhanced effect. We mix the platelet-rich plasma protein concentrate with a medication that activates the platelets, and this mixture is then injected into the tissues in which the rejuvenating effects are desired. This mixture then releases large quantities of these growth factors into the tissues, and that's what actually does the repair and rejuvenation effects. Now, as men age, they have a tendency to develop erectile dysfunction, which means difficulties in both achieving and maintaining an erection of their penis sufficient to engage in sexual activities. This inability is a result of failure of the smooth muscles in the penis that should contract to retain blood in the penis and bring about an erection. These smooth muscles can usually be restored to their normal function through the use of platelet-rich plasma therapy in the penis. This treatment, called a priapus or P-shot, acts to restore normal erectile function without the need for taking any medication, and as a side effect will cause penile enlargement as well. Now that's a side effect that most men and their partners have no complaints about. We also have the O-shot for women. This treatment was originally developed to treat urinary incontinence, and it does usually work quite well for that application. It also has been found to enhance sexual function in women. It improves the orgasmic response in women. It has the effect of making it easier for women to achieve orgasms and can even sometimes bring about the ability to achieve multiple orgasms. The PRP injections can also be utilized as a way to obtain larger and firmer breasts without resorting to surgical implantation of potentially dangerous artificial implants or by painful fat grafting and implantation procedures. The platelet-rich plasma, usually combined with plasma protein concentrate, is injected into the breast at specific locations and volumes, which causes the breast to enlarge and the tissue inside the breast to increase in firmness, resulting in larger and more erect, perkier breasts. All three of these procedures are performed in the office and have a very low incidence of complications. The patient comes into the office on the day of the procedure and we draw their blood. Blood is then put in a machine that separates the platelets from the rest of the blood and then concentrates the platelets. And, if desired, it also makes a protein concentrate as well. The entire procedure is quick, usually takes less than 30 minutes. And because we apply a topical deadening agent, there is only mild pain during the procedure. The recovery time from these procedures is relatively short and the post-treatment discomfort is minimal. Well, I hope this presentation has been interesting and enlightening. If you have any additional questions or would like further information, please contact our helpful staff. We thank you very much for your time and attention watching our video.